Hello and welcome to Rajya Sabha TV. I'm Tina Jha with News Tonight, where we get you a daily roundup of all that's happening across India and the world. Let's begin with an update on the COVID-19 situation in the country. Well, India's COVID-19 count has climbed to 12,000, with the death toll now standing at 414. According to the Health Ministry, the number of COVID-19 cases in India now stand at 12,380. 941 fresh cases were reported from different states in just the last 24 hours. 1,489 people have recovered so far. At 2,916, Maharashtra continues to remain the worst COVID-19 affected state. Delhi stands second with 1,578 cases, followed by Tamil Nadu with 1,242 positive cases of COVID-19. Rajasthan also saw an increase with COVID-19 cases going up to 1,023, followed by 987 cases in Madhya Pradesh, 735 in Uttar Pradesh and 766 in Gujarat. The state of Telangana now has 647 cases of COVID-19, followed by Andhra Pradesh at 525 and Kerala at 388. Novel coronavirus cases have also increased to 300 in Jammu and Kashmir. Briefing the media, Health Ministry Joint Secretary Love Agarwal said on Thursday that as many as 325 districts across the country have not reported any fresh case of COVID-19. The Health Ministry has also issued an advisory for safe drinking water practices during coronavirus lockdown.
हमारी इस लड़ाई में, हमारे इस एफर्ट्स में अभी तक भी फील्ड लेवल पर किए हुए एक्शन के तहत 325 ऐसे जिले हैं जहां पर कोई भी केस नहीं आया है। हमारी केस फैटेलिटी रेट अगर 3.3% है तो हमारी परसेंटेज ऑफ पीपल हु हैव रिकवर्ड सो फार इज अराउंड 12.02%। साथ ही फील्ड लेवल पर जो कुछ ऐसे जिले जहां पर इससे पहले केसेस आए थे लेकिन फील्ड एक्शन के द्वारा उनको कंट्रोल और उनके कंटेनमेंट से संबंधित जो काम हुआ है उसके तहत माही इन पुडुचेरी एक वह जिला है जहां पर पिछले 28 दिनों से कोई फर्दर पॉजिटिव केस नहीं आया है। इसके साथ ही 27 ऐसे जिले हैं उन 17 राज्यों में जहां पर पिछले 14 दिनों से कोई पॉजिटिव केस नहीं आया है, जिसमें है कि पटना बिहार से, नादिया वेस्ट बंगाल से, प्रतापगढ़ राजस्थान से, गिर सोमनाथ पोरबंदर गुजरात से, भद्राद्री कोथागुडम तेलंगाना से, साउथ गोवा गोवा से, उत्तराखंड से पौड़ी गढ़वाल, पीलीभीत इन यूपी, राजौरी इन जम्मू कश्मीर, वेस्ट इम्फॉल इन मणिपुर, बिलासपुर, दुर्ग, राजनांदगांव रायपुर में, छत्तीसगढ़ में, पुडुचेरी में जैसे मैं बता चुका हूँ माहिब, ऐजवाल वेस्ट जो है मिजोरम में, देवनगिरी, कोडगु, तुमकुर, उडुपी और बेल्लारी कर्नाटका में, वायनाड कोट्टयम केरला में, SBS नगर पंजाब में, हरियाणा में पानीपत और मध्य प्रदेश में शिवपुरी।
Meanwhile, the Indian Council of Medical Research tested 2,90,401 people till date. Of them, 30,043 were tested at ICMR and private laboratories on Wednesday. Speaking on the testing capacity of ICMR, scientist Raman Gangakhedkar said one shift could test over 42,400 samples per day, while two shifts are able to test over 78,200 samples each day. Both the centre and the state governments have stepped up efforts in the fight against COVID-19. The Bihar government launched door-to-door screening in as many as 8,000 villages in 4 districts of the state, while Karnataka Chief Minister B.S. Yediyurappa inaugurated a COVID-19 testing mobile van in Bengaluru.
आज तक हमने 2,90,401 लोगों की टेस्ट की है। उनमें से 30,043 यानी 30,043 इनकी टेस्ट कल हुई। उसमें 26,331 जो थे वो ICMR नेटवर्क के जो 176 लैब्स है उनमें हुआ है। 3,712 ये प्राइवेट लैब्स में हुआ है जिनकी संख्या अभी 78 है और उनके कलेक्शन सेंटर्स ये 16,000 सिटीज़ के अंदर पाए जाते हैं देश भर में। ये जो कैपेसिटी का बार बार इशू आता है, अभी आपने देखा कि 26,331 वो नेटवर्क में से हुए हैं। हम अगर 9 घंटा काम करते हैं, जैसे एक शिफ्ट में करते हैं, तो हमारी अभी जो लैब की कैपेसिटी है वो 42,418 है, और अगर हम उसको बढ़ा के 2 शिफ्ट में कर दें तो 78,227 लोगों की टेस्ट हम हर दिन कर सकते हैं।
ICMR clears that India is in a better situation compared to other countries globally, where India tests 24 people to get one positive case of coronavirus, Japan tests around 11 and US tests around 5. The Union Health Ministry, on the other hand, said there are 325 such districts in the country that have not reported any case of coronavirus in the country so far, following lockdown, social distancing and containment measures. The message is only that if we follow lockdown, social distancing and containment measures in the country, we can be such one districts. Anu Diwan for Rajya Sabha TV.
The World Health Organization has hailed India's decision to use its polio surveillance network in the fight against coronavirus. Now, the reaction comes a day after the Health Ministry and the World Health Organization initiated a systematic engagement of WHO's National Polio Surveillance Network and other field staff for COVID-19 response in the country. The WHO chief said in a Twitter message that such joint efforts will help defeat the coronavirus pandemic. In fact, he also thanked India's Health Minister Dr. Harshvardhan for his engagement with the UN body in the fight against this global crisis. The National Polio Surveillance Project, launched in 1996, played a critical role in strengthening surveillance for polio that generated data to guide policies, strategies, and interventions to eradicate polio in the country. The project, renamed the National Public Health Surveillance Project after polio was eliminated in the year 2011, has supported a number of public health emergency responses, including Ebola, since then.
It's like a history being repeated for coronavirus. Maybe polio was something about which we knew. There was an international pledge, international WHO 1980 pledge of the World Health Assembly. Here we probably don't know much, but I am sure that with joint efforts we'll be able to defeat the virus, and we should be able to save as many lives as possible, and that will certainly require the services of my surveillance corona warriors working in the field, whether they belong to the IDSP or whether they belong to the state governments, rapid response teams or WHO.
Meanwhile, the Director General of the WHO has expressed regret over the United States' decision to suspend funding to the global health body. US President Donald Trump had announced America's decision on Tuesday about suspending funds to the World Health Organization. And speaking at a press briefing, the WHO chief said he is reviewing the impact that the withdrawal of funding will have on its operations.
When the nations of the world met to form the United Nations in 1945, one of the first things they discussed was establishing an organization to protect and promote the health of the world's people. That creed remains our vision today. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. But for now, our focus, my focus, is on stopping this virus and saving lives. WHO is grateful to the many nations, organizations, and individuals who have expressed their support and commitment to WHO in recent days, including their financial commitment. We welcome this demonstration of global solidarity, because solidarity is the rule of the game to defeat COVID-19. We will continue to work with every country and every partner.
My colleague Akhilesh Suman now joins us live on News Tonight to help us understand why the United States is upset with the World Health Organization.
Right, Tina. Actually, Americans are very upset with WHO, the World Health Organization, for 2-3 things. One thing that Americans feel that WHO did not give them proper information in proper time, even when Americans are the biggest fund provider to WHO. And they also tell that WHO had adopted double standard in two things. As far as travel issues are concerned, if WHO was knowing that travel ban was necessary, then why WHO told that international travel bans should not be adopted by all other countries and also the Americans? Even when WHO praised that China had banned travel inside its own territory. So if travel ban was necessary inside China, why travel ban was not necessary outside China, for Chinese going outside the country and everyone going inside Chinese and again going out of China? So this was a major thing that American President Donald Trump has said. The second thing it has been telling that that WHO told that there is no human to human infection, but it was found that there was human to human infection, and that is why it was declared pandemic later on, and that is why many countries who had adopted travel ban are more successful than who accepted WHO regime for not enforcing travel ban in the very beginning. So I think these are two major questions, and the third question, as I told you, that information was not shared with America by WHO properly and in proper time. So these are the three things about which Americans are very upset, and that is why they have told that till the WHO comes out with investigation, proper investigation about how it took place, Americans are not going to release the fund for WHO.
Okay, Akhilesh. So now what are the measures that the US wants the WHO to take in order to lift the suspension on its funding?
Actually, many countries were telling for reform in WHO, and Americans are also telling now. Actually, it was Prime Minister Narendra Modi who had first told that there is a reform requirement in WHO, and now White House has released 4-point suggestion to WHO so that it can get rid of the present lacunae it was undergoing. And the most important thing I am going to tell you, though this is the 4th point in the whole list, and this point says that increase access to medicine and counter China's outsized influence on the organization. So it is very overt accusation on WHO that it is oversized with China's interference and influence. The second thing that Americans are telling, that WHO has shown it was not prepared to prevent, detect and respond to severe infection disease crisis like this. That means technically WHO was not ready. Second thing, WHO lacks the structure to ensure accurate information and transparent data sharing from members, which makes it vulnerable to misinformation and political influence. Again, it is indictment of WHO. And the third thing, United States seeks to refocus the WHO on fulfilling its core missions of preparedness, response, and stakeholders coordination. So I think Americans have suggested that WHO was not ready technically, it was not ready to give transparent data to every member nation, and it was over influenced by China. So I think it is a big accusation, and it needs every country to come on board so that WTO can reform inside itself.
All right. Okay, Akhilesh. Thank you for joining us with those details on News Tonight. India has received 5 lakh testing kits, including rapid antibody test kits from 2 Chinese firms. These kits will help India ramp up its testing capacity in a major way to fight the COVID-19 pandemic. The consignment is part of the total order of 15 million personal protective equipment kits and 1.5 million rapid testing kits that India had ordered from China.
रैपिड टेस्ट किट्स आए क्या? 2 किस्म के रैपिड टेस्ट किट्स आज आ चुके हैं. एक लिवजॉन करके कंपनी का है, एक वांटफ्लो करके कंपनी का है. ये जो टेस्ट किट्स हैं, इनकी संख्या लिवजॉन की 2 लाख और वांटफ्लो की 3 लाख है. इन दोनों किट में थोड़ा सा फ़र्क है। फ़र्क यह है कि लिवज़ॉन का जो किट है, लिवज़ॉन का किट और वानफ्लो के किट में आईजीजी और आईजीएम दो अलग बैंड्स आते हैं क्या? एक इसमें दोनों बैंड एक साथ होते हैं, जिसके बारे में हम थोड़ी चर्चा करके देखें। इन दोनों किट्स की सेंसिटिविटी 80% से ज़्यादा है और स्पेसिफिसिटी भी तकरीबन 84% से ऊपर ही है। तो जिस ढंग से इनका जो क्लेम है कि ये टेस्ट अच्छे हैं, शायद उसका पहला इस्तेमाल होगा और हमको खुद को भी उसके बारे में फील्ड कंडीशंस में का पता चल जाएगा।
More than 2 million cases of COVID-19 have been reported from across the globe so far. The death toll due to the deadly virus has crossed 1,30,000. According to the World Health Organization data, there are at least 14,39,357 active cases globally, and more than 5,16,600 people have recovered so far. The United States tops the tally with more than 6,44,000 cases. More than 27,500 people have lost their lives due to COVID-19 in the country so far. The number of cases has crossed over 1,70,000 in Spain. In Italy, the number of critically ill patients have been on a decline, but with several new infections, the total number of cases has crossed 1,65,000. France and Germany have also reported over 1,30,000 cases so far. The World Health Organization on Thursday said the coming few weeks are critical for Europe as the number of confirmed COVID-19 cases is nearing the 1 million mark.
In the past 10 days, the number of cases reported in Europe have nearly doubled to close to 1 million. This means that about 50% of the global burden of COVID-19 is in this region. Sadly, over 84,000 people in Europe have lost their lives to the virus. Of the 10 countries in the region with the highest numbers of cases, there have been optimistic signs in terms of declining numbers in Spain, Italy, Germany, France and Switzerland in recent weeks. But small positive signals in some countries are tempered by sustained or increased levels of incidence in other countries, including the UK, Turkey, Ukraine, Belarus and the Russian Federation. The next few weeks will be critical for Europe.
Meanwhile, China on Thursday reported 46 new confirmed cases of coronavirus. The National Health Commission said most of the new cases are attributed to Chinese nationals returning from abroad. The total number of confirmed COVID-19 cases in China has now reached 82,341. India facilitated the return of 41 Pakistani nationals who were stranded in India due to lockdown through the Attari-Wagah border post today. The Ministry of External Affairs facilitated their return at the request of the Pakistani High Commission in Delhi, which confirmed that their citizens have been repatriated to Pakistan. The Ministry of External Affairs brought the Pakistani citizens to the Attari border from different parts of Delhi, Haryana, Uttar Pradesh and Punjab. Ahead of the movement, the ministry directed that all the returning Pakistani nationals had to be screened as per norms and only asymptomatic individuals may be allowed to return. In all, 188 Pakistani citizens have been stranded in India due to lockdown. The remaining Pakistani nationals will also be repatriated at the earliest.
India's assistance to Pakistan is part of humanitarian support India is providing to all countries who are requesting to India. And in this part, 35,000 foreign nationals have been evacuated till now. Whoever is requesting, India is providing. Sometimes India is also providing aircraft, but sometimes the respective countries are coming with aircraft and taking their nationals. So it's a huge exercise and India is providing, helping all nations. And Pakistan has also requested, and in this way India is helping Pakistan also. So India is not helping only in evacuation, but India is also helping in supplying medicines. And almost 55 countries have been supplied with medicines. Some countries for grant and some countries have been given medicines on commercial basis also. Akhilesh Suman for Rajya Television in Delhi.
The first consignment of nearly 3 million packets of paracetamol sent to the UK by India is set to be distributed across the country's supermarkets and retailers in order to stem the spread of coronavirus pandemic. The shipment followed India's decision to lift export restrictions on essential drugs. India had recently placed 2 drugs, hydroxychloroquine and also paracetamol, under the licensed category for exports, while freeing up 14 other drugs completely, thus opening the doors for exports of these drugs to India's close neighbors and also its strategic partners like the US and the UK. Exports of all these drugs were previously banned by the centre following the COVID-19 outbreak. The shipment of paracetamol packets arrived in the UK as a series of chartered flights laid on by the UK government to ferry thousands of British residents stranded in India began landing in the country since earlier this month.
United Kingdom has been one of the worst affected countries from coronavirus, and United Kingdom Prime Minister Boris Johnson was in ICU now, though he's out of ICU but is still recuperating from corona positive. And in that context, sending paracetamol from India to UK is considered to be a big gesture of friendship between the two countries, and that is why UK's trade minister has congratulated India and also has hailed India for showing this type of gesture. Actually, paracetamol along with hydroxychloroquine was in banned category, but India opened for some countries, and now 55 countries of the world are getting benefit of India's medicine like paracetamol, hydroxychloroquine or erythrocin. So these are the medicines, and India is cooperating with almost all countries of the world who are asking for India's help. And in that context, help to United Kingdom is much more important than many other countries. Akhilesh Suman for Rajya Sabha Television from Delhi.
Moving on, the G20 group of leading economies, including the US, China and also India, have finalized an action plan to suspend debt repayments of some of the world's poorest countries. The aim is to help countries deal with the health and economic impacts of the coronavirus pandemic. The suspension of debt repayment to the International Monetary Fund and also the World Bank is an effort to bring financial stability and creating scope for a fiscal stimulus in these countries already distressed by the COVID-19 outbreak. In all, 76 poor countries will benefit from the agreement, which starts from the 1st of May 2020. The decision was taken by finance ministers and governors of the G20 nations after their second virtual meeting. Debt suspension will include both the principal and interest and will be available to all the least developed countries as defined so by the United Nations. The action will free up more than $20 billion for the countries to spend on improving their health systems and fighting the coronavirus pandemic. Each beneficiary country will be required to commit to use the created fiscal space to increase social, health or economic spending in response to the coronavirus crisis. Finance Minister Nirmala Sitharaman, who participated in the virtual meeting, welcomed the action plan, calling it a step in the right direction.
I want to finish with the gratitude to the G20 for exceptionally rapid decision on debt relief for the poorest countries. It would release billions of dollars for them. And that is exactly what we need.
The government has directed all Indian airlines to refund to passengers the airfare for the lockdown period. This after several complaints were received that domestic airlines were not giving cash refunds for flights that have been cancelled due to the lockdown and instead were issuing credit for future travel. The DGCA order on the matter says that if a passenger booked a ticket for travel during the first lockdown period between 25th of March and the 14th of April and requests a refund for the booking being cancelled, the airline shall refund the full amount without levying any cancellation charges. Airlines will also have to refund tickets that were booked for travel during the second lockdown period between the 15th of April till the 3rd of May. Senior officials of the Ministry of Civil Aviation and CEOs of Indian airline companies had met on Wednesday to discuss the issue. The government on Thursday issued a set of guidelines for the safety of private users. In particular, it red flagged concerns over the Zoom meeting app, which it said has issues over safety, security, and privacy of users. In a new set of guidelines, the Home Ministry said the Zoom meeting app is not a safe platform for video conference. Ministry officials said that Zoom bombing or the unauthorized entry in the conference rooms of this application has apparently become a favorite pastime of people during the lockdown period. The Home Ministry has also asked private individuals using Zoom to follow certain guidelines. These include preventing unauthorized entry into a conference room, preventing an unauthorized participant from carrying out malicious activity on the terminals of others, and avoiding DOS attack by restricting users through passwords and access grant. A detailed advisory has already been issued by CERT India, and according to Home Ministry officials, the servers of Zoom, like TikTok, are mostly located in China. The center maintains that the application has significant weaknesses and also indulges in dubious practices. An Indian Air Force Cheetah helicopter made an emergency landing following a technical snag on a highway near Hindon in Ghaziabad. The helicopter was on its way to Chandigarh from the Hindon airport on a COVID-19 mission to bring test samples from Leh. The Indian Air Force said there was no damage to any property, the snag was rectified, and the helicopter then returned to Hindon. The IAF has deployed a sizable number of its transport aircraft and helicopters for ferrying medical equipment to remote areas of the country. And that's it from us in this bulletin. Thank you for your time.